Good afternoon and welcome to our Digital Transformation Tech Talk. This is our 15th webinar in our Tech Talk series for the aged care sector. My name is Janine Bennett and I'm the engagement lead for the digital transformation work underway in the Department of Health and Aged Care, and I'm delighted to welcome you today. Thanks to everyone for joining us. I'm joining you today from the lands of the Ngunnawal and the Ngambri people. And I'd like to recognise the traditional custodians of the land I'm on today, offer my recognition and respect to the people and families with connection to those lands around Canberra and its regions. I wish to also reflect our collective respect for First Nations people and their elders, as well as their continuing contribution to our culture and our country. And also acknowledging the Aboriginal and Torres Strait Islander people who are joining us today. It's great to have you with us. Before I hand things over, the usual quick housekeeping. In the interest of transparency, we've been having a few WebEx issues today. IT support has assured us that we're good to go for the event, but should you have any technical issues during the event today, there is a dial-in option that you can use as a backup to rejoin. You'll find that phone number and the code on your meeting invite. It's also on your screen now if you'd like to take a quick snapshot of that. Hopefully we won't need it, but it's there if you need to get back in. In the event that things go horribly wrong and the system drops out for everyone, we will email you at the registration address that you provided to us just to let you know that it's happened, and we'll look for an opportunity to reschedule when the IT is working a little better. As always, we're recording today's webinar. We'll post the recording on our website in the next week or so, along with the slide deck from today's event. It'll be up there online so you can refer back to the information that we cover today, or feel free to share it with others in your network. As always, we'll finish up today's session with a Q&A. You can pop your questions into the Slido at any time. Typically, you'll see that Slido window at the bottom right-hand corner of your WebEx screen. Basically, once you put your question in, it'll be available for people to see. They can vote it up, vote it down. If you do submit a question and you're happy to ask it live on camera, you can join us on our virtual stage. So before we bring you up, we'll give you a warning so you can get ready. Our tech team will then do their magic in the background to get you ready to go to the main stage and ask your question directly to the panel. All you'll need to do is to turn on your video and audio and ask away. If you're happy to do that, please remember to include your name when you submit your questions so we know who you are and we can find you in the attendee list. If you're feeling a bit shy today, that's cool too. You can go ahead and ask your burning question. Just post it anonymously or write "no stage" when you submit it, and I'll go ahead and ask the question to the panel on your behalf. This webinar, we have also had a few questions submitted in advance, so I wanted to thank our attendees who provided those. We got a couple of questions about Sparked and the FHIR data standard, the FHIR data standard, and we're happily going to talk about that in the agenda today, and we have our friends from the Australian Digital Health Agency here to hit on that topic. You were also very curious about various elements of the Support at Home initiatives. We're investigating answers to some of those questions offline, and we're also looking for an opportunity to get a representative from the Support at Home team to join us at an upcoming Tech Talk so we can really focus in on that very popular topic. For today, as always, we'll try and get to as many questions as you can. Feel free to add them throughout. We love to see what you're curious about. Okay, onwards. I'm pleased to introduce to you our host for the day, Faye Flavaris. Faye leads our digital transformation and delivery division that is building the technology that enables aged care reform for the sector. Faye is a skilled technologist and a committed public servant. She's held leadership positions across banking, consulting, and then more recently in government. Over the course of her career, Faye has taken on many large-scale transformation programs, delivering first-of-a-kind digital capabilities, and that's a little bit of a flavour of what she's doing for health now. Faye is heading up the digital transformation for aged care on behalf of the department, and she's here to host this event today. I'll see everyone again in Q&A, but over to you, Faye. Thank you.
Well, thanks, Janine, for those kind words. And hello, everybody. It's hard to believe it's been 6 weeks since we were last here. I must call out straight up that I'm struggling with my voice today, so hopefully I can get through it. If I have a little bit of a coughing attack, I'll probably throw back to Janine, but he's fingers crossed. Welcome back to our regulars and to those for joining us for the first time. It's great to have you here in our Tech Talk community. Let's take a quick look at today's agenda. I'll start with the usual transformation update, where we talk about what our current status is. And we've also got a bit of a video today. It's an update on our business to government gateway developer portal that we've got out there. So really looking forward to that. It's also a very welcome back to Australian Digital Health Agency. They're usually a crowd favourite with us. So we're delighted to have Lisa Murphy with us here with an update on the Fast Healthcare Interoperability resource. Many of you will know that as the FHIR standard for short. And then we have Susan Drainer from the department with an update on the Aged Care Taskforce's final report that went to government, and a bit of an explainer of some of the suggestions on how to enable more innovation in the aged care sector that was provided. As always, we'll wrap up the webinar with our Q&A. And as Janine mentioned, you can post your questions in the Slido as you go along. Sometimes we can see them, and if it's a topic that we're presenting in the moment, we might answer straight away, but otherwise we'll save them all up for the end in the Q&A. Okay, so without further ado, let's get started. For anybody new to our discussions, I'll start with a little bit of a context of why we're here and the work that we do. Briefly, we're in the business of digital transformation solutions that we build that enable aged care reform. The aged care reform started back in 2021, and by my guess, it will continue to at least 2025. So right now, we're roughly at the halfway point of the reform. And so far, we have developed digital solutions to support and enable a range of reforms and different measures and commitments. Some of our building foundations that we've done around digital transformation are two primary platforms called Government Provider Management System, which is GPMS, which is our single provider portal that interacts with us in government. And then our B2G platform, which is our business to government platform, which is where our software community can interact with us and start connecting their software to us to make the administrative burden on the sector less by ensuring they don't have to double entry between our systems and the systems they already have in their own ecosystem. We also have a third platform, which is the My Aged Care portal today, that we continue to introduce new enhancements to and new functionality as based on the different measures. So I've been especially busy in the sector this month as well. Oh, actually, hold on. Yep. Can I get the next slide, please? I've also been especially busy in the sector in the past month, attending a few conferences and meetings and forums, really getting out there and speaking with lots of people, and heard a range of feedback on the work that we're doing, different views and perspectives, and some insights, because, you know, it's always handy for us to understand what the things we do and how we work, and what does it mean for you guys in the sector, and the practicalities of you adopting some of the changes that we're putting out there. And so I came away with a few hot topics and themes that stood out for me around some of the things that are very front of mind for you in the sector. And I thought I'd share some of those with you guys today. So in no particular order, these are some of the things that I heard. Artificial intelligence is definitely a topic that everyone's talking about. They're thinking about what it is and how it can be used, and what role the AI can play for providers delivering care, but also how older Australians can access the care. So our draft aged care data and digital strategy that's out on the department's website does outline some of the ways that we've thought of that it could be potentially used. The example I give is how can it maybe help write executive reviews on things, or care notes. How does it summarize care notes practically in an easier way? But the care use cases are endless, and I think they will be evolving rapidly as people better understand what AI is and how it can be used. We at the department, it's very early days for us, and we're evaluating and proceeding very carefully to make sure that it's used in an appropriate way. But we're attempting to stay on the pulse of innovation that is happening in the sector, as well as how the broader government is approaching AI and any potential regulation that might be put in play. Emerging technologies is another topic of interest that I keep hearing about. AI is definitely the flavor of the month, but truth be said, a lot of new tech is popping up all the time these days, with the strong focus on connected wearable devices, also embedded sensors, and there's a whole bunch of other capabilities where technology plays that sit under a broad umbrella of what we call the Internet of Things, and how things in sensors and how things get connected. We're seeing a lot of items falling into this category that are helping older people live more independently, safely, and for longer in their homes. While our work on digital transformation isn't building these devices specifically, we do see how the IT industry advancements across health and aged care hold a lot of promise to support reform recommendations using emerging technologies. So let's watch this space in this particular topic. Interoperability is also a big discussion point. It's clear from my conversations in the past month that you believe every Australian should have a seamless experience across the healthcare system, and that interoperability between services is very important. We're actively exploring the potential for connecting the provider experience across care systems, especially in overlapping areas like aged care, veteran cares, and disability care. So that's definitely a line that we're looking at. And we also, to do that, we need to make sure that we have agreed standardized data, and to ensure that we're sharing it safely across government as well. So it's given that we know that aged care doesn't kind of exist in isolation on its own, and that depends a lot on the rest of the healthcare ecosystem. And in fact, it's one of the major touch points where various elements of care intersect. I think the interoperability agenda is very front of mind for people. And data is very important for actually being used around insights as well. So how do you get access to data? How do we speak the same language? How do we share data? So more on that, especially we've got our agenda item later on from the ADHA. And finally, cybersecurity is the other topic that came very front of mind when we were chatting throughout the month. Privacy and information security, when it comes to developing digital solutions for the aged care sector, is definitely a hot topic for us. And we get lots of questions about how can we collectively rise to that challenge, because we're all connected. If we want to get connected digitally, then we all need to have that same level of standard. So all of us in government, providers, software vendors, consumers, we all need to be in the business of safeguarding the trust, privacy, and security for people in Australia. And across government, in addition to all the usual regulatory checks that we have controls around, we have additional controls around privacy and security. And we're looking at those data standards and frameworks very actively, as well as information sharing agreements to make sure that all the data is stored safely and securely to keep the trust in the system strong, and making sure that we're only sharing with those that should be getting it. So I hope you have enjoyed the themes that I heard. I'd like to just keep the conversations going. Please reach out if you feel that there's any other hot topics, and send those through so we can continue to use that to help inform where we spend our time and how we can come back with you all on some of these themes. Now moving on to our digital transformation roadmap. Here we have our aged care IT portfolio roadmap. With this, I'm going to share my usual disclaimer. This is our technical delivery roadmap, the digital roadmap, not a commitment from government. These slides represent what we're working on right now, but our work is subject to government policy, planning, and decisions, and as such can be changed at any time. You might also notice that our timeline, which we typically try to project out at least 6 months, isn't showing its usual forecast. We're in a bit of a tricky place at the moment. We're awaiting budget decisions from government. So while we await those formal announcements, we're holding back on putting the forward calendar. But needless to say, for now, I can share with you we are actively forward planning for the next financial year, and we are proposing what we're proposing on and working on. And once we get some government decisions, this will be the first place that we share it, and we'll give you a very solid view of those commitments in for the new financial year, hopefully in the next month. If not next month, it'll be the one after. In the meantime, I encourage you to keep just tuning into these webinars, because this will be the place where we give you this information as soon as we're able to. So for now, I'll give you a little bit of the July takeaways from the slide here. We're doing some minor enhancements on the government provider management system, including some enhancements to the provider operations reporting. We're going to do a small enhancement on the quarterly financial reporting to capture outbreak supplement reporting. And there will be a 24/7 update on nursing reporting, both for GPMS and for our business to government gateway. We'll be going live with the first API there for the software industry to be able to communicate that reporting to us automatically. Preparation for the new Act with dormant functionality to support places and worker registration is being put in place, ready for when we need it. It will not be turned on, but we're kind of working ahead of the curve. And GPMS self-service portal launches, enabling self-service digital enhancements around maintenance of organizations and personal information those organizations have, and also regular reporting for determinations and notifications. And this is, I think, the first time we'll be offering up a self-serve around being able to update those features. So really looking to avoid you guys picking up the phone and waiting on the call. Just get in there and change it yourselves. So very excited about those features. Prior to July, in the July release, you'll notice that this month for B2G, we're enabling providers to be able to consume an API in the production environment, as I said, one of the first. That's going to enable the streamlined reporting for 24/7 nursing. There are an additional 4 APIs that are available in our software testing environment for software industry and developers. That is the Registered Nurses API, there's a Provider Management API, there's a Quality Indicators one, and then there's the Authentication API. And so these 4 can be found in our developer portal today, and people can go in and take a look and start their API development journey with us. So please give it a go. We would be excited to have more people join us. Now you might go, well, how's this going to work? Well, taking a closer look at what it takes to take your API journey with us, we have a bit of a video here, and I'm pleased to share the video features an interview between one of our sector partners who's been on this journey with us to adopt API. His name is Tate Johnson. He's the CTO for the Lookout Way. And he did a bit of an interview with our B2G product manager, Steve Smith, and they're talking about his experience on co-designing the Business to Government Gateway API developer portal with us, and how easy or hard it's been for him to adopt it. So team, if I can ask you to play the video. Let's see if we can get the tech running.
Here at the Department of Health and Aged Care, we have established a Business to Government or B2G API gateway. B2G will support the aged care reforms by establishing a direct flow of information between aged care providers and government. For providers, this technology can reduce the time spent on administration, enabling workers to spend more time delivering direct and high-quality care. Improve data to inform and uplift care, as well as streamline transparent reporting that demonstrates the quality of care being delivered. For older people, this means they can receive more direct care, experience an uplift in the quality of care, and access better information, helping them make informed decisions about their care. Establishing B2G wasn't done in isolation. Through our sector partner group, we have collaborated with aged care providers and software vendors to co-design a solution that will benefit both providers and older people. Since the launch of the B2G Developer Portal in September 2023, software vendors have been able to build and test their software against the API standards set by the department before submitting their products through a conformance process. Once a vendor's software achieves conformance, they can consume the APIs in the production environment. Their products can also be released to aged care providers, who can submit mandatory reporting via APIs in the B2G API Gateway. Hear what Tate Johnson, Chief Technology Officer at the Lookout Way and member of the Sector Partner Group, had to say about his experience with B2G and collaborating with the department.
We're going to have kind of a little bit of an interview style session. Got a few questions. So Tate, I'll leave it to you to introduce yourself firstly.
So hey everyone, my name's Tate and I'm the CTO at the Lookout Way. Having been a part of this group for ages, it's been exciting to kind of see this stuff come to life. And yeah, as Steve mentioned, they invited me today to kind of talk candidly about what my experience is like.
Cool. And Tate, you touched on it there. You have been part of the Sector Partners journey for quite a while. How have you found it more generally, the approach?
I've really enjoyed it. Talking specifically about the API, I remember there was a co-design session and it was like a Miro board. There's all these questions around how to design this API. I'm a software developer by trade. I felt like my feedback was being heard, which has always been the promise of this group. And then to finally get a chance to play with the developer portal and kind of see lots of that stuff come through, it does make me feel like I've been heard. And it's easy to talk today candidly when, the decisions you feel like are being made are really good ones for the industry and for the people we're ultimately caring for. So it's been really good.
How did you find the developer portal and its general usability, look and feel and function?
I evaluate lots of different integrations and APIs. And so the key things I look for is how quickly can I get an idea of the shape? Because that ultimately then dictates sort of what the effort's going to be, how you need to resource to handle that. It probably went above my expectations in terms of the amount of sort of diagrams and documentation that was in there. It was very easy to follow.
And look, I think I'll jump down to the APIs if that's okay with you, Tate. So, the beginning of the year, we let the first group of APIs out into the wild, into our software verification testing environment for people to be able to come in and start developing their software. Did you manage to successfully connect to the system and use any of the APIs that we have in there?
I have actually had a good poke around and I've been able to make successful requests and get responses back. I was really happy with sort of some of the design decisions that were made.
One of the things I'm interested to hear about is our hybrid FHIR approach that we've taken for quality indicators and just your general thoughts on using that approach.
In terms of the FHIR approach, I'm a supporter of it. I think it makes sense to use what's expected kind of in industry for interoperability. I think it's a good design decision. I guess it gives me hope that as additional APIs come through, if they keep following that format, I think industry will be very happy with that.
The final thing that I wanted to talk to you about, the conformance and testing process that we have in place.
Overall, I see it as a pretty big step up from what's been done previously. It gives me hope, I guess, going forward that conformance will be it's important to do. It is intensive, but at least it's being made a bit easier. It was quite good. On the whole, I'm very pleased with what I'm seeing. It gives me a lot of hope. We can be fast at implementing these things for our customers as the government and regulation changes. I'd love to see more home care stuff. At the moment, I know it's all residential. I understand that it's led by department. As soon as more home care stuff comes in there, we'd be really excited.
For more information about B2G, you can contact us through the email on your screen or visit our website.
How great was that, folks? I'm very excited. I want to say a big thank you to Tate for doing the interview with us and all of our sector partner community for their tireless efforts in helping us deliver solutions that work for us and for the sector. So that's been very exciting. For anyone who would like to get involved, a QR code and the email address is on screen to get more information about how our sector partner group works. Our April Business to Government Gateway release will deliver for aged care providers to report on critical areas of care. The release is planned to go out on the weekend starting the 20th of April, so that's when we'll be in production. Noting that B2G Developer Portal has been out in the real world for some time now already, So any developer or software group can get up online today. That's developer.health.gov.au, and you can register your intent there and start coding against those APIs that we already have up in the development environment, and start testing them in our test harnesses there. So everyone can look forward to the B2G team joining us again for our next Tech Talk in May to discuss the release and see how we go from there. Up next, we have our first featured speaker for today. Lisa Murphy joins us from the Australian Digital Health Agency. Lisa's going to talk to us all about the Fast Healthcare Interoperability resources, or what everyone calls FHIR for short. For those who haven't heard this term before, FHIR is basically a set of rules and specifications for exchanging data between systems. And so the FHIR standard is very specific to the healthcare sector. And I would just like to hand over to Lisa and welcome you. Over to you.
Thanks, Faye. So I'm going to do the presentation today on behalf of Ryan Mavin, who is the branch manager for the Connected Care branch at the agency. So my name's Lisa Murphy. I'm the Director of Standards within that branch. And today I'll be giving you an overview of the National Healthcare Interoperability Plan and the agency's National Digital Health Standards Program. So in the standards program, we're really responsible for the Aged Care Clinical Information Systems project, which I'll give you a quick update on, and also a particular interest in FHIR as a standard, as Faye was just explaining. And I'll give you an update on the Sparked initiative and the benefits of being involved there. So next slide, please. So building on some of the themes that Faye obviously brought up in the last presentation, healthcare interoperability really does support that safe and secure and efficient way to exchange information. So it needs to involve an ecosystem of connected care providers that share seamlessly high quality data with easily understood meaning. So the National Healthcare Interoperability Plan was published in 2023 after all health executives endorsed the plan. So it really provides a pathway to a more interoperable health system, and it includes both public and private systems. So the goal of the plan is to enable access to healthcare when and to where it is needed, and to harness the power of health information to drive that whole of person care. So we have to also remember that Australia is starting from a solid base and has some key foundational pieces in place already. So the plan goes to identify 5 key priority areas that will foster that foundation and create a more connected healthcare system. It really sets the direction for a nationally coordinated future state and leverages current activities and creates opportunities for future innovation. So in the plan, there are 44 actions. These actions are categorized into immediate, ongoing, short-term, and medium-term. So that gives the span of the life cycle of the plan. Again, the 5 priority areas: identity, standards, information sharing, innovation, and benefits. So if we can just go to the next slide, please. So the Council of Connected Care was established to provide strategic advice and oversee implementation of the plan itself. The Council's objectives are really to facilitate and support the implementation of the plan, but really is also to include identifying opportunities to accelerate interoperability in various parts of the health system and identify ways to harness these opportunities. It's really to promote and garner support for digital health initiatives that drive the connected care agenda, and it's really useful to identify barriers to achieving interoperability and ways to overcome them. So the Council of Connected Care has about 31 senior officials, so that's been drawn from Health and Care Continuum, and it has digital health technology sector and academics included as well, who we recognise are critical to actually enabling and progressing the interoperability agenda. So the Council has met 4 times to date, and the next meeting is in May, and that focus will be on information sharing. So the next part of the presentation, I'll focus on an update on the Aged Care Clinical Information System Standards. So if I could just go to the next slide, please. Now, I know the agency has previously provided updates to the group on this project, but just as a refresher, the agency is delivering this project on the behalf of the Department of Health and Aged Care, and it's in response to 2 specific recommendations from the Royal Commission into Aged Care Quality and Safety. So the project specifically addresses that every approved provider uses a digital care management system, including an electronic medication management system, meeting a standard set by the Australian Digital Health Agency and be interoperable with My Health Record. So at the core, the project is really to support the uplift of clinical information systems used in residential aged care homes to a recommended minimum system standard to support interoperability and connected care. We go to the next slide, please. So to really understand the benefits to the aged care sector and to support understanding why standards and particularly standardisation are important to the sector, the agency developed in collaboration with clinicians, providers and industry, some supporting principles and quality statements. So the purpose of these high-level statements is really to articulate to the aged care sector and clinicians the benefits of the clinical information systems adhering to recommended requirements. There are 5 key principles with supporting quality statements, and they really have been used to drive the project. The project will have 3 key deliverables. The first is complete and is the gap analysis or environment scan. So we built this gap analysis on a framework to encourage co-design and collaboration. Digital health standards were assigned to 6 broad categories. So connections to national systems, for example, the My Health Record. The second being standard payload formats for exchange, for example, FHIR. The third being standards for point-to-point information transport methods, for example, a secure messaging delivery system. Number 4 being standards for local software controls, so local cyber controls. 5 being standards for on-screen display of clinical terms, for example, clinician-facing language. And the final category being standards for terminology code sets, for example, SNOMED. So the categories really just provided a structured approach and a way to address a range of topics. The aim of the gap analysis was to identify publicly available specifications and standards that would be suited to the aged care clinical information system. At the moment, the gap analysis environment scan has been sent to our National Standards Advisory Group, the Department of Health and Aged Care, and the Australian Commission on Safety and Quality in Healthcare for final validation. We've had a number of focus groups with a number of software vendors as well to ensure that we're on the right path with those categories and the framework we've applied to the work. The second deliverable for the project will be a recommended minimum system requirements for residential aged care homes. This document is currently being drafted and we'll have consultations scheduled shortly to finalise the requirements. The primary audience for this document will be developers. And the third and final deliverable is an implementation roadmap. We're just beginning to put together the consultations that will progress this work, but the roadmap will focus on 2 key areas, the first being change and adoption, and the second being any standards development that has been identified. If I could go to the next slide, please. So this slide simply shows the achievements of the program to date. What's really impressive is that we held some co-design workshops to validate the principles and quality statements, and we had an impressive 130 people attend and contribute. And those people were across the aged care sector, including jurisdictions, clinical peaks, government organisations, providers and clinicians. We've also completed the first draft of the Aged Care Clinical Information System Standard and associated deliverables, and so we're well on our way for completion in 2024. The next steps for us is webinars to allow the aged care sector to have input into the recommended minimum requirements and the implementation roadmaps. We really want to keep the co-design happening that has been happening through the development to date. And we also want to do some more consultations on the minimum system requirements and the roadmaps themselves. So as I mentioned before, the products will be released in late 2024 and we'll be in contact, and there will be some communications around when the next webinars are scheduled for. And we'd love you all to be involved. The next slide, please. So I just wanted to give an overview on the Digital Health Standards Program here at the agency. So this is kind of our bread and butter. The agency is really actively engaged with other countries and a number of standard development organisations, and we're getting the message that government needs to take a greater role in all of these organisations. We're building closer relationships with standard development organisations, both locally and internationally. And we have formalised agreements with a number of local SDOs, including HL7 Australia and Standards Australia. We're currently working on 5 key relationships. SNOMED International. So the agency's role here is to act as the national release centre for SNOMED CT and be a part and provide the national clinic, the NCTS. And the agency is also has membership on the General Assembly and member forum of SNOMED International. The second relationship we're working with is HL7 Australia. So the agency currently has an MOU with HL7AU and is a Tier 1 member and is engaged with HL7 on ongoing education and training initiatives for FHIR. Standards Australia, we have a statement of intent with Standards Australia, and we've established a work plan with points of collaboration and support. We're active members also of their working groups and committees. IHE International, we're building closer and closer relationships with that organisation as well. And finally, GS1. The agency has a long-standing relationship with GS1 at a local and a global level. So I do appreciate the challenges of developing and evolving standards that are fit for purpose to solve real-world problems. What we really want to get across here is all the standards are pieces of a puzzle, but we need to work together to get the big picture, or it won't come together. The agency is taking our role in stewarding standards very seriously, and we've established the National Digital Health Standards Program to provide leadership, orchestration and stewardship that is required nationally to progress the standards agenda. Next slide, please. FHIR, as we've all alluded to. One of the most important of the standards within this complex space as we look to enable connected care in Australia is FHIR, which is managed by the Standards Development Organisation HL7. The acronym for Fast Healthcare Interoperability Resource, or FHIR, is built around the concept of resources. Fundamentally, the aim is to build a base set of resources that either by themselves or when combined satisfy the majority of common use cases. FHIR resources aim to determine the information contents and the structure for core information set that is shared by most implementations. It will often reference other standards such as terminologies from SNOMED, identifiers from GS1, or observations from LOINC that help define the information. FHIR delivers faster application development and interoperability, plus boosts information sharing in healthcare, especially on mobile platforms, through its flexible and scalable approach to problem solving and interchange of data. So what that means in Australia is, the next slide, please. So to help speed the FHIR implementation along in Australia, the Sparked FHIR Accelerator Program was established. So the Sparked program is a collaboration between the agency, the Department of Health and Aged Care, CSIRO, and HL7AU. Sparked is one of the flagship programs delivering under the standards program at the agency and is already delivering significant work to help define resources we need to ensure that we can easily share and use data within and across our health system. Sparked is based on community and acceleration. This community is comprised of government, technology partners, provider organisations, peak bodies, practitioners, and domain experts. What we are accelerating is the creation and use of national FHIR standards and specific related standards in healthcare information exchange. So Sparked is producing a number of outputs, but what's really important is to remember it's got a core data set for interoperability. It's got 2 FHIR implementation guides, one for AU Core and one for AU e-requesting. some value sets for terminology for pathology and radiology, and testing, validation, and piloting of data sets and IGs. What we really need to do is ensure that all sectors are involved in the accelerator to ensure that FHIR standards meet as many people's needs as possible. We don't want to consider standards development or implementation as silos. We need to build consistency across sectors and across a whole system in order to see rewards for patients, clinicians, businesses, and overall to the healthcare system. The agency driver is to provide consistent and ongoing leadership to the standards agenda. The standards program here at the agency is focused on ensuring we have effective communities to develop standards, but has a particular focus on the adoption of all relevant standards. This is how we're going to achieve the connected care agenda. So I would encourage you all to get involved into Sparked. My team can share the resources and Confluence pages about how you join and when the next meetings are. The next face-to-face meeting of the working groups will be held in Sydney in May, and it provides a great opportunity to get involved and to ensure that aged care is a part of the use case discussion that's ongoing with the Sparked collaboration. So that is a brief update on what we are doing here at the agency on the interoperability plan, the Aged Care Clinical Information Systems project, and the Sparked collaborative. So with that, I'll hand back to Faye.
Thanks, Lisa. That was a wonderful overview of the work that you guys are doing at ADHA, and more specifically around standards and FHIR. And yes, I'm definitely on the bandwagon on the FHIR work that everyone's doing more broadly in digital health. And I am trying to come up with a couple of use cases that are aged care related that we might be able to put up as use cases for HL7 to vote on for the next round. So if anyone's got any ideas, please let us know. I think I've got a couple of days this week to get back to them on. So any help there, I would be greatly appreciated so that we can prioritize aged care in the HL7 ecosystem and start working out how FHIR can be extended to some of the aged care resources that in the information standards. So thank you so much. We might keep moving on. And in case anyone missed the headlines, the Aged Care Taskforce report was handed out last month, and the report made some recommendations to government around aged care funding. Given Australia's ageing population, it's essential that aged care funding keeps up with increased demands for aged care services. And given how often the topic area comes up in my Tech Talk series here, I'm pretty confident this next presentation from Susan is going to be a bit of a favourite. I believe this is your first Tech Talk with us, Susan. Don't worry, they're a wonderful community. They're very nice. So over to you.
Wonderful. Thanks. Thanks, Faye. And thanks everyone for having me. Really excited to join you all for the first time. So we'll just jump straight to the next slide. So as you may well know, the Aged Care Taskforce was established at budget last year, and it was established to review aged care funding options for the future that are sustainable, fair and equitable, with a goal to help create a more vibrant and innovative aged care sector. During its 6 months of operation, the task force met every month, and it also consulted really widely. That included a written submission process in August last year, in which more than 180 submissions were received, 11 stakeholder roundtables, which were facilitated by individual task force members, and that included representatives from more than 1/3 of aged care beds across the country. COTA and OPAN on our behalf conducted 12 town halls and a nationwide survey of older people and their families. And then the task force members themselves engaged with their own network. So each task force member was appointed with specific expertise in mind that meant they could contribute valuable perspectives. So following that consultation process and significant deliberations by the task force, they handed their final report to government right at the end of last year, and Minister Wells published that. Released that report on the 12th of March this year, and it has attracted quite a lot of attention, as Faye mentioned, and started to encourage quite a lot of debate around the key topics. So we'll just jump to the next slide, which will cover some of the key challenges that the task force identified and the real need for change. So the task force report identified a real case for change and a need to move away from the current funding model to something that would help to get the sector future ready. In particular, within that, we've noted that Australians are living longer than ever before, which is a great thing. But it does mean that we need more and better aged care services available for a population of people over 85 that is expected to grow to more than 3 million people over the coming decades. With the need for more aged care, there's a need for more money to fund that aged care. And that funding includes improving access to in-home care. It includes funding to build additional high-quality aged care rooms. And it also includes more immediately the need to address the current funding viability issues that the sector faces. So we know that more than half of residential aged care providers, I should say, are currently losing money. And so that's an immediate need to address that, both so that the sector can be viable, but so that it can then undertake the investment that's needed to do that additional building. At the same time, for older people, the system must provide quality care. And it must be, and the task force identified that the current system is really complex, and there's a need for an aged care funding system that is simpler and more transparent for people to understand what you get for what you pay for. The government has a really important role in funding the sector, as you can see on the pie charts on the slide. Currently, the government funds 75% of residential care costs and 95% of in-home care costs. But it's not sustainable to continue on that sort of trajectory. The intergenerational report last year found that without reform, government spending on aged care is projected to grow from 1.1% of GDP today to 2.5% of GDP in 40 years from now, which is a rapid rate of growth, both in real terms, but also as a share of the total government spend. At the same time, the task force found that older people are wealthier than previous generations, and part of that is due to the maturing of the superannuation system, where we're starting to see people approaching aged care age who had the benefit of 30 plus years of superannuation accumulation. We've also got a population of older Australians with around 80% home ownership rates. So the task force found that this meant there was an opportunity to seek a greater contribution for those with the means to do so as part of its reform package. So we'll just jump to the next slide now. The task force made 23 recommendations in total. These were guided by 7 principles, which we then categorized into three main groups. The first of these is to support older people to age in place. So that means remaining at home for as long as they wish and can do so safely. That's consistent with what we heard through the task force and through other channels, is increasingly the preference of older people, that they would prefer to remain in their home and receive aged care services in their home wherever they can, noting that that's not always possible. The next 3 principles talk through the need for funding models to be equitable and sustainable. So that comes back to our point about easy to understand, equitable meaning that the contributions made by individuals are fair for what they are paying, but also equivalent between different people based on perhaps how they pay, the type of services they receive, and so on. The task force recommended that the government would continue to be the major funder of aged care. That's particularly the case for their care costs, and that the role of older people should be focused more on what we call everyday living or hoteling and accommodation costs. And those are the sorts of things that people pay throughout their lives. So their house, their sort of everyday living expenses. We include things as simple as toilet paper that we all pay for through our lives, but that there was a sense that it is fair to ask for a continued contribution for those sorts of things, that's just a continuation of life's journey effectively. And that the residential aged care sector should be able to access enough capital to improve the quality of accommodation in particular. We know there's a really large looming capital gap at the moment, where the sector's in need of around $37 billion out to 2050 to build and maintain aged care rooms to deliver on that quality aged care accommodation. And then I think the third group, quality, innovation and transparency, is probably where I'll focus for the remainder of my time. The aged care system, look, we think it's really important, or the task force thought it was really important, that reform should deliver person-centred quality care. And that's including a skilled workforce. And that is reflecting the fact that there's not a desire to just put more money into the system for no change of outcomes. There's a real desire to see funding deliver and drive continued improvement of the aged care system. Innovation was a really important point for the Aged Care Taskforce. They felt that not just innovation for its own sake, but innovation that improves the services delivered by the sector, that delivers innovative approaches to care, that helps residents to see real value for money in the services that they receive. But also they had a real interest in what it might do for the interaction between the health and hospital systems. So not just someone's journey through in-home care and then potentially their journey through residential aged care, but how that interacts with the care they receive from their GP, where they need to go into hospital, trying to make that it will never be a totally seamless journey, but at the moment they really identified a lot of friction points in that space. And whilst the task force did not make specific recommendations in that space, it identified it as an area for further work. And then the last point was about transparency and accountability for how aged care funding is received and spent, but also minimising the regulatory burden. So we did hear from a number of providers a perspective that we ask for a lot of data, and sometimes we ask for the same data in lots of different ways. And so one of the things that the task force suggested was making sure that this sort of reporting is genuinely adding to transparency, and it's not asking you all to incur too great of a regulatory burden cost for no actual real benefit to the sector or to participants in the sector. So I'll just jump to the next slide. There was a particular and then I'd just like to briefly focus on particularly recommendation 19. The task force made several recommendations in that innovation and transparency space, noting that financial viability issues and reporting requires are currently limiting providers' ability to innovate. We heard through consultation a desire to be able to do innovation, but a real sense that at the moment the financial position of the sector means that all the money is sort of focused on maintaining the status quo, and there's a real barrier to innovation. And so the task force really did see this opportunity to improve innovation and space for innovation by addressing those viability and sustainability issues. So effectively, that's a precondition to an innovative culture. But there was also a sense that more could be done to improve innovation, that it's not just a money thing. There was a real sense that it would be great to be able to find ways to share innovation best practice and to embed an innovative culture across the sector. So one of the things that the task force considered would be useful in that would be a role of government in amplifying good innovative practice, just to encourage those who are already being innovative to find ways that they can share that with other providers and effectively raise the standard across the sector. One potential way that the task force recommended doing that would be to task the Aged Care Quality and Safety Commission as an agency that could promote adoption of best practice across the sector. That would be based on what they see day to day engaging with providers on the ground. They have a really a good understanding generally of the operations of businesses and would have much more latitude than other parts of government to understand operations and identify and encourage innovation where practices that could be shared more widely are found. But we are, I think, still very much open to other ways to deliver on these ways to develop and scale innovative care models. So I think that the task force identified some ways, but also noted that there's a real appetite to continue to drive this once that viability piece has been settled. So I'll just jump to the next slide. The next, I guess the key question that many people have for us now is what's next. So it's really important to note that at this point, this is a report to government, and with the exception of the recommendation that the task force made to not introduce a new tax, at this stage, the government has not responded to the recommendations of the task force. They are carefully considering them. There's a lot to this report, and then I think it's probably fair to say there's a lot of additional detail. So the task force made some really great recommendations, but there's a lot of detail that would need to be worked through. before these would be, any of these recommendations would be, I think, ready to roll on the ground. So there will be a continued need for us to work with providers, older people, and other stakeholders on the details as the work progresses towards a response, and then from a response towards implementation and having something that both delivers on the intended goals of the task force, but is also workable for the broader sector. So that is something we're really eager to hear from those attending today, as well as the wider aged care community, as we continue to progress on this work this year. So I think everyone's really keen to get into the Q&A phase, so I'll pass back to you.
Thank you so much, Susan. And I found that really informative. You know, reading the report is one thing, but, you know, when you do your explainer over the top, it gives it so much more context. So thank you so much for that. If anyone's got any Q&A around the report, now's the time for you to slip it into that Slido, because we've got Susan here on the panel with us to help us answer it. In the meantime, I'll ask Janine and any of the other panel members to join us back up on stage. We do have a few Q&A items in the list already.
We do.
Thank you.
Yeah, we've had a good
Janine,
number of.
I'm going to throw to you to start with, but I just thought I might bring everyone's attention to some of the links that Gary's already put into the Slido. I think there was a question around how they could become a sector partner, and where they can find the recordings. And so I think you guys have already answered those ones.
We've answered those too. We'll put all of those links into the post-event email as well, just in case you have trouble accessing from here. The other thing you can do really easy is Google Digital Transformation Tech Talks or Digital Transformation Sector Partners, or go to the Department of Health and Aged Care website and search for both of those terms. It comes up nice and easy for you. So hopefully anyone who's interested can get into those. So we do have some good questions already today. Thank you to Faye, Lisa, and also Susan for being on the panel with us. I'll start by just issuing a bit of a stage warning to a couple of our very popular questions and our people who are asking those. So first of all, if we can queue up Stuart Smith, Emma Hossack, and also Michelle Jones. So we will get those folks ready to come to stage. In the meantime, as our tech team are setting you guys up, just keep in mind that when you come to stage, we'll just get you to turn your camera on if you can, and definitely your audio. To get us started though, I'd like to open with an anonymous question. So this one actually is from Rob Slattery. So it's not anonymous. Rob's in an environment today that isn't conducive to turning on video. So I'm going to go ahead and ask the question on his behalf. The question is, will the agency be considering ambient listening for MAC, My Aged Care, I'm guessing that is, and the providers to assist with transition between customers, providers, and the agency?
I think that's to assist with translation between customers, providers, and agency. And I think I'm going to need a little bit more information on this one. So I think, Rob, ambient listening, it's not something I'm familiar with. Probably should, but I don't know, Susan, if you're across that at all. But otherwise, maybe can you post another piece in and do a little bit more of an explainer to me, because I'm not exactly sure what the ask is. And so I don't think I can answer that one.
I think that might be one of our emerging technologies that we were talking about earlier.
Probably.
But yeah, hopefully we can get a little bit more detail and we can come back to that one. In the meantime, how are we going getting Stuart ready for stage? Can we bring Stuart up? So just for the information of our panelists, Stuart has a comment and a couple of questions, all quite popular in terms of their interest to the audience. So one is around the emerging tech, and then we have a couple of questions discussing the similarities across the care economy providers in aged care and disability, and then also in relation to the FHIR standard. So do we have
Janine, unfortunately, it looks like we may have lost Stuart. We're hoping you might be able to read his questions off on his behalf.
All right, let me bring those up and we'll get those going. Thanks. Give Give me one sec. Okay. So first of all, there was a comment, great to see recognition of a range of technologies that are being considered by the department to ensure maintained independence in older adults. Keen to see a deeper dive into emerging technology in future webinars. Did you want to respond to that comment at all, Faye?
Say it again. Sorry.
So effectively, Stuart's just saying that they're keen to see a deeper dive into emerging technologies in future webinars. Do you think that's something we could
I think we
accommodate?
could definitely do that. And if anyone's got any innovative examples of things that have worked, I know there was a provider who won an award in during this month's ITAC conference for using robots in the residential facility. I think we could definitely curate some examples of where innovation with technologies has helped to reduce administration of some form that will then free up time for people to do more face-to-face physical caring. So yeah, absolutely. I think we can do that one.
Great. And then the next question was around the overlap with NDIS. So Stuart says, regarding the technologies to enable independence, how much communication is occurring between aged care and disability? I think that's another one for you, Faye.
It might be, but I'm curious to see, just a quick question. I shouldn't really ask all these ones on the fly, but I'm going to anyway. So Susan, in the Aged Care Taskforce, was there any NDIS, discussion at all when you guys had some of that?
Oh, look, I mean, not within the task force report itself.
Right.
The task force did, of course, have regard to the broader social services space, I think,
Yeah.
and that included relationships to disability, as well as to, of course, the pension system. That's a really important interaction between the aged care funding model. We did, of course, there was a parallel NDIS task force over at PMNC at the time, and the two task forces did work together to try and make sure they were complementary in everything they did.
Yeah, lovely. And I can say that there was a policy proposal last year in the MyEFO round of funding that I have led around ICT harmonization in the care sector. There is an active piece of work that we're doing around looking at some of the technology, digital platforms that we've created, being GPMS and B2G, and the potential reuse of those across the NDIS Quality Safety Commission and DVA, the Department of Veterans Affairs. That is currently in progress, and I can definitely say that we can bring that in a few months to this agenda, but also maybe as a topic area in our sector partner community to get some input from everyone. So but the answer to the question, probably not as much as we would like around discussions. I think we can definitely be working with our counterparts in the business. I think they're doing a little bit more around policy harmonization as well, but nothing sort of in the development stage at the moment. So all around the discovery and ideation stages.
Great. And then the last question from Stuart was an interest in understanding better the role of FHIR technologies that will enable older Australians to remain living independently in their own home. So you can see a real theme from Stuart's comments around independent living, rather than being focused more on residential clinical care settings. I think this would be one for Lisa, and then maybe a follow-up from Faye.
Sure. I think we have to remember that FHIR is a standard, so it's agnostic of the setting that it's being used for. So the context in which I provided an update about the aged care clinical information systems had a specific remit to focus on residential aged care facilities, but the same principles and standards and technologies apply agnostic of setting. So I would say that, FHIR plays the role in enabling patients to manage their healthcare information and to securely share it with their healthcare providers and others. So that's the benefits of sort of using FHIR as a standard there, but it is agnostic to the setting in which you're using it for.
And just to extend on that one, so FHIR is very much a clinical standard. But you do reference in your question around aged care and its care. And there is another standard called Interi that actually interplays with, I think, the FHIR standard nicely. It does have a little bit more around the different types of care levels that you would more want to track in a care setting as opposed to a health setting. And so we are actively talking in the department of, because there's not really one standard to rule them all in my mind. And so it's about having that data dictionary or lookup that says how does one language map to the next language, and we use the most appropriate one depending on the information domain that we need to exchange data with. So I'm getting quite technical here in a little bit, but it is about then having that catalog of APIs that we have out there in the software community, and just having clear indicators to go, these ones were clinical APIs, but actually these ones are care APIs, and here's the standard that we used here. And so I think the more that we can align and understand each other, I think the more flexible we'll be able to be around how to exchange information in a meaningful fashion.
Great. Thank you
What's
for
next?
those answers. Okay, so we will bring Emma up to stage now if she's available. And in the meantime, we'll just ask a quick anonymous question. How can a software vendor get access to the test environment? And I'm assuming, Faye, this is the B2G environment, so that question's over to you.
Okay, so the B2G environment, and I think the team did put the link there, I think, maybe not, but otherwise I'll ask the team to post the link to the developer.health.gov.au website. It absolutely has the process by which you guys can register your intent to be able to just create an account. That's where you'll start the process of identifying who you are, authenticating yourself, and actually then going through a conformance process. Whilst you go through that process, you do have access to all of the APIs that we have in the catalog and all of the resources there to start coding and testing against those APIs. You won't get to production. You don't get to the end until you've passed your conformance process and you've proven that you can connect with us in a safe, secure way, and that you sign up to all of the kind of the rules that we've put in place to say that you will keep the systems private and confidential and safe on your end. And it's all part of that raising the tide in the community to make sure that everyone's managing the security and privacy of the data of the customers that we hold at the same level, so security posture level. So hopefully the team will plug that in for you. But yes, you can get started on the journey now. Oh, look, there it is. Gary's put it up. Thanks, Gary.
Excellent. Thank you. And Emma's joined us on stage. Emma, feel free to turn on your audio and video. And Emma has a comment around the interoperability journey.
Do we have her?
Oh, I think thinking where she may not be getting it. All right, I'm going to go ahead and ask on Emma's behalf. So Emma mentioned that the scale of what Faye, you and your team are doing in transformation is breathtaking. That's a nice compliment. Can it be leveraged through the agency in other areas of the Department of Health and Aged Care to speed up deliverables, leverage great work, and put concrete shape into interoperability for all of health, including aged care? That's an ambitious.
I know.
Yeah.
I wouldn't expect anything less from Emma. Go for it, Lisa.
I was just going to say, I think it's just an opportunity to point out the collaboration, obviously, that the agency and the Department of Health have been having through this whole process to do with the B2G, and the work that we're now doing on the My Aged Care and My Health record kind of work. So I think it's just I think we are learning from each other, if I can say that, Faye. I don't know if you want to add anything onto that.
Yeah, definitely. So I think this is where ADHA does in the background to us assist in actually executing the conformance. So and doing that piece. I think as a platform though, the B2G Gateway as a platform and as a method of interacting with the sector, I do believe there is some opportunity to extend that more broadly and put other APIs there that go beyond aged care. I'm currently in discussions with another area of the department over in the TGA and the pharmaceuticals area and so forth. The platform is agnostic in that sense, and given that it's been co-designed, I will keep hitting up my colleagues over in the digital health space. Maybe when they get past the first sparked phase and they want to start putting up what the first version of a catalog could look like, I would love to see that we start leveraging the B2G gateway for that. So let's see, watch this space. I think all of you in the community should advocate out in your respective areas, and I'm happy to try and publish up a catalogue that's outside of the aged care domain and see how it might work more broadly.
Thanks, Faye. It's Emma here.
Ah, she's there.
I'm sorry, the videos, I don't know what's going on, but anyhow, thank you very much for that answer. And to be clear, I wasn't trying to insinuate that the agency and the department weren't working together at all. And what I was trying to say, perhaps not very well, is that because you've been able to go so fast, perhaps because of this format, which is a first, of course, and you've got so many people involved and you've been able to shape it, you've kind of leapfrogged a lot of other areas that I know as an industry we're involved in. And because you've done that, and maybe unexpectedly, but you've done it, it would be marvelous rather than having like two, catalogs, product catalogs. If there's one that's working, can we please use that? It makes it so much easier for industry, and it means that all the agencies and departments don't have to divide all of their skills and can really focus on getting stuff done and not really replicating infrastructure. And the other thing was, Stuart, I think it was, said that it would be great if we could obviously leverage what is happening in this area for NDIS, or is that intended? And I kind of always assumed it had been, and I should have said that in my question as well, but it's such a good point, because on the call as well, there's a lot of people who are involved with aged care at home, and rather than just the resi care, which all seems to get the focus despite the numbers going the other way, far more people at home looking for home care. So if we could perhaps, if you're doing anything as far as focuses and timelines, it would be so great if we could now start leveraging what you've got and put some shape into the care at home. Which then is more similar to NDIS too, that kind of model.
Yeah, so on the ICT harmonization space, absolutely, I think that's where that we could leverage GPMS and B2G in NDIS and veterans. I think as you guys are talking to other counterparts in the sector, when they're doing work, it'd be great to keep it front of mind with them and go, well, have you thought about leveraging this? It's very, it requires, I think, a few people pulling in the same direction. We are having conversations, but it needs I think a little bit more to get it across the line. I think, Lisa, we can take it as a takeaway to see, is there a possibility of there's a use case that you guys might be doing that maybe we can accelerate through this forum? And I don't know if anyone's got any suggestions, let us know.
Yeah, I think we've got some, I took an action before listening to you, Faye, as well, that maybe we can connect about potential collaborations between our catalogue, for example, and lots of things that we are doing that we can accelerate for each other, I think is a great point.
Yeah, great.
Fantastic. Thank you.
Thanks, Emma.
Thanks very much, Emma. Okay, just a reminder to bring Michelle to stage from my team. And I'll also give a quick heads up to Brandon and George, who will queue up for the stage after that. In the meantime, we've had a little bit more detail from Rob about what he means by ambient listening. So it's related to the way in which a clinician does not need to take written notes crafted during the engagement with the customer or client. It enables AI based translation of what has been heard into notes, which can then be included in the client health record. So that is that sort of note-taking element that you had mentioned during the tech talk, Faye. Did you want to add any other comments about that?
No, not really, in the sense that I think there's a number of ways that AI can work. Some people see it as they'll take notes and then get an AI to summarize it. I think that doesn't that doesn't actually stop the person having to do the administration in the moment, or they've got to remember it. They've got to walk out the room and, remember everything. I think there is a notion that you can just bring it in, turn it on, and let it hear the interaction and let it summarize it for itself. I think that's definitely an experiment that someone could try and see how it goes. AI, I think, is going to be one of those things where you're going to have to test and learn and iterate in a very safe way, and figure out where it applies and where it doesn't. And I don't think it should be in its first instance used anywhere where it makes a decision on behalf of a human. Right, it's there as an enabling technology, not as a replacement of a. But that would only be my a little bit more context and insight into some of the comments I make.
Great. And we've got Michelle. Michelle, if you're able to turn on video, that'd be great, but definitely audio. For the panel, Michelle is a community home support provider. Michelle, welcome.
Hi, can you hear me?
Yes,
We
we can.
I'm not sure if I can turn the camera on.
You're on.
You have. We've got you there.
I can see you.
Okay. All right. So, yeah, I'm in an open office. I'm a CHSP provider. We provide services to clients in their own home, domestic assistance, personal care, etc. We use a third-party software vendor, and we've often talked to them about these changes are coming, and they said, "Yep, tell us what you need from us, and we've got an undertaking that we will enable you to be able to do your job." There is no, well, let's come and collaborate, or let's see what's going on. It's, whatever done and dusted, we'll do the reporting for you, so that you can, whatever the requirement is, so that we can function. So while I want to get involved, I'm not really at that technical level. I support the system. We do testing, but how do I get involved?
So there's a number of things. It really comes down to how much time you've got, but maybe just invest a little bit of time and sign yourself up as a sector partner to start with. You can come for a couple, and then when you see a topic area that you think might be relevant, you can get an understanding of the process or the method that we go through. When we're going to enhance our system, it might be, let's just take the 24/7 nursing. Maybe that's not a good example for you. Maybe the approved provider operations reporting. I can't remember which of the exact regulatory reporting we've put out that maybe you get in at the moment and have to provide us. But there'll come a time when we want to offer up an API where your software vendor can connect to us. So instead of you getting onto the portal and keeping track of it once in your own system and maybe twice in ours, that's where the software provider can connect to us automatically. So we really got to find what's that next project that we're going to do together. And I think post-budget, I'm definitely sure we'll find one for the support at home environment, where we can then get your software provider to go, well, the next lot of regulatory reporting that we're going to have to do to government in the CHSP space will be X. Can I get involved in designing how we do that, and so we can automatically enhance it to government? I'm thinking at the moment there probably hasn't been too many in the last 6 months opportunities that have not been outside of that residential aged care facility space. And so I don't know, do you guys do quality indicator reporting? I don't think so. Yeah, so I think most of the new reforms that we've done to date have been in that residential side, as Emma has said. I think you'll find post-budget we'll start focusing more on the CHSP side, and I think that's where you'll have the opportunity to get involved and get your software vendor to work in with us. In the
Just
meantime,
to let you know, the software vendor would be saying we don't have the resources. I mean, we've
Yeah.
gotten that before because it's not built. It's not a requirement to experiment or to collaborate. It's a requirement for them to make us functional. So, I mean, that's just one of
Yeah.
our challenges.
No, you're right. And I think maybe this is having a very open, transparent conversation now. I think this is where, as software providers, we need and we need to ask them going, well, what is that requirement? So if government hypothetically puts out a new mandatory reporting for CHSP providers, let's say for example, and this is by no means that I've heard anything, but let's just say that tomorrow they say that you guys will have to start submitting quality indicators, right? Becomes a mandatory thing. It'll go live maybe, in 12 months time, who knows, making things up now. Then it becomes a discussion with the software vendor to say, well, shouldn't you, maybe come to the party on that? If not that software vendor, maybe someone else will. And I think that's the discussion we need to have with software vendors to go, when we sign a contract with you, what's in the contract? Have you signed it with a clause that says that they will have their software, it will stay up to date with all mandatory reporting for government? And I think this is what this tech talks about, is having really open, transparent discussions around how do we transform the sector? Because they're providing a product that will service many customers like you and others. So you guys can't be expected to, drive it. Like as a product, you want them to do it. I'm not sure if that's helped, and I've been a little bit controversial, but anyway.
We like a bit of controversy in this webinar, so that's all good. Thanks, Michelle. Really appreciate the question and obviously prompted a good discussion. We've got Brandon queued to come to stage next, and in the meantime, a quick anonymous question. I can see on the roadmap personal care workers would have a way to register. Do domestic care workers also have a way to register?
I think
we don't have the business partner in the room for that one. Are you able to have a go?
No, I think the registration roadmap is about GPMS workers registrations, and it's around providers registering their workers. So unless they're a provider, the context of this one is a provider who's on GPMS and who are going to register their workers. They won't register themselves, no. It's in that context, yeah.
Thank you. And Brandon, over to you. And just a reminder that we'll get George straight after Brandon.
Brandon off mute because we can't hear you if you're not.
Hi, Brandon.
Hi there. Sorry, I wasn't in the quietest spot, so I just had to move quickly. Hi, I'm actually a reporter at innovationoz.com, so thank you very much for the updates today. I just had a quick clarification question for Lisa. I was just wondering if it's possible to get if there's any more clarity on the timeline regarding the other deliverables of the CIS standards, whether the draft recommendations have a specific date you're aiming to before the final version is released in late 2024? Thanks.
It'll be released around August 2024 by the time we're finished.
Cool.
Thanks very much. Cheers.
No problems.
Thanks, Brandon.
Great. Thanks, Brandon. Thanks for dropping in. Okay. How are we going with George? I just know that we're quite close on time. So if we can get George straight to the stage. Hi, George. Great to have you back.
Hi, everyone. Thank you. Thanks for the support for ITAC last week. It was all went well. Two quick questions. One follows on from Michelle's around providers having a challenge of how they make sure the software they buy is standard compliant. So conformance and certification, is that sort of on the agenda from the standards group?
Okay, so just a replay of that if anyone had any problems hearing. It's a little bit muffled on my end, but it's around certification of software. So how do providers know that they're buying software that is compliant? And do we have a plan for that? Faye, to you.
So look, I know, and Lisa, maybe you can add to this a little bit. The ADHA has a list of software vendors that have been endorsed to connect with them. Like we're in B2G, we've taken a slightly different approach. We've opened it up for everyone. At the moment, as people are going through the conformance process, It's a good question. I think I can take it away to say that once people have passed the conformance process, maybe what we need to do is publish them so they can see which people have been passed and for which parts, like which APIs, because, you know, they might have been passed conformance, but only registered for one API. And people are going to want to know that they've registered for all 10 mandatory APIs or whatever. I think we'll definitely take that one on as some feedback to make sure that we build it into the next tranche of enhancements for B2G to be able to publish who's connected and endorsed. That won't necessarily tell you are they approved for all standards per se, like in a sense, but it will tell you which ones from a reg reporting perspective that they've got covered in their software.
Okay.
Hopefully that helps.
Yeah, and I guess, I mean, we had that discussion with Emma as well, how the industry bodies involved as well. The next question is around AI. I mean, obviously, it's the buzz. We saw it
Sorry,
in the
George, we can't hear you that well.
I can,
read out the question here.
I can jump in for you, George. Thank you.
Thank you.
So the question was around, obviously there's lots of excitement around AI and aged care.
Yeah.
However, the limiting factor to date is data quality, both for training and use. The department's work on the use of AI opens the way for a better use of standards. Can we ride on that activity to develop and test AI use cases?
It's definitely a good idea. I've had that suggestion made from someone else in the sector as well. I think we need to take that back internally and have a discussion around how much data and can be shared. I think, Lisa, it's one for the department as well. I think you guys are also talking about an information exchange. Maybe that's a topic area that we need to include there as well. How do we get all of the data available?
Yeah, I think so. I think it's something that we can continue talking about. It's obviously not a sector problem. It's a whole healthcare thing, which we'll have to tackle like that.
But I think it's great that you guys raise them, because it really shows that when we get a question maybe that comes up on repeat, it's a topical area. And so it helps prioritize what areas that we focus on next. And that one has come up as a little mini theme. So I think we should definitely focus on that one a bit more. Thanks, George.
I think those challenges around AI are facing the world as well. It's not just aged care or government or providers. This is a big one for all of us. I am actually going to have to call it there. Unfortunately, we had a bunch of other questions that we haven't been able to get to, but with 3 minutes to go and we like to end on time, I better just take my moment to say thank you to Lisa, who's joined us on a quick return from leave, filling in for someone. So thanks so much for coming again from the ADHA. We love it when you guys come to visit. Susan, thanks. Good to have you, first time joiner, hopefully not the last for our tech talks. It's great to have you with us as well. We might just make the closing slide bigger again. Thanks, guys, just so people can see the contact details there. Really appreciate all the excellent questions we got to today. And the great discussion that we've had between our attendees and panelists. Getting really close to being out of time. So I just wanted to acknowledge the video contributors, Tate Johnson and Steve Smith and Jess Holmick, who pulled that video together. That was a fantastic B2G interview. We really loved that, and we'll try and produce more of that type of content for you in the future. Some quick reminders. Please remember to register for My Health Record. That's a message from our ADHA friends. If you need support to do this, you can go ahead and contact the ADHA and they're able to step you through the registration process. We also encourage everyone to visit the Residential Aged Care webpage. There are links and resources there that the sector will find useful and informative. As always, we'll put today's recording and slide deck up on the Health and Aged Care website. You can expect that in the next 2 weeks. You can find all the recordings for our past tech talks there, or you can go to YouTube and have a look at us on the Department of Health and Aged Care YouTube channel. In the meantime, please take a moment to complete our post-event survey. The QR code is on screen now. We'll send you a link in the post-event email as well. The survey is quick to do. It helps us make these sessions more useful for you. So we really encourage you to take a sec just to get that completed. We'll be back in 6 weeks for the next Tech Talk. That'll be our last one for the financial year. So stay tuned for details on that one. Any agenda items or topics that you'd like to see, please let us know. Pop it into the survey response or email us. And that is it from me. Thanks for hosting, Faye, and over to you for closing us out.
Yes, thank you, Janine. And big thanks to our speakers and everyone for joining us here today. Remember, this is an open forum. Everyone is welcome. You might have a colleague that you know who has a great idea and some insights into the kind of topics that we cover off here. So please encourage them to come along. I'm not sure if you noticed, but sometimes the attendees we have are actually older Australians who join us here to have a listen. You're at the centre of all the work that we're doing here, and we would be thrilled to have you here and put your hand up and ask a question. So love to have anyone who's, you know, our true customer come on and give us some insights. Like Janine said, we're here to share information with you, talk, listen, and that's where we get the real value of these events and with the broader community. Thanks for coming. I look forward to speaking to you again in May. Have a good month.